these four healthcare stories.
The gentleman from Colorado.
I thank the gentleman from Minnesota for the time. I want to share with you the story of Jerry from Boulder, Colorado. Several years ago, Jerry wanted to have an MRI on his left shoulder to determine the cause of rotator cuff pain that was becoming increasingly bothersome and disabling. But it took his insurer, Anthem Blue Cross, over a year to approve the procedure. In the meantime, he had to deal with that pain every day. Jerry also shared that when his son turned 25, he needed to have his own health care insurance policy, and his son is healthy, but takes an antidepressant. As a result, the insurance companies list him, like tens of millions of other Americans, with the scarlet letter, a pre-existing condition, and he has to pay over $300 a month for a basic policy for a healthy 25-year-old. And that's despite the fact that his doctor wrote to the companies indicating the condition is very stable and is not currently in treatment. Jerry's doctor now charges a membership fee so that he's able to have the ability to see less patients for longer amounts of time. He needs to have several clerical staff just to handle the insurance claims of the different companies. Each company, of course, requires different information. Jerry and his wife pay a combined $7,200 a year in health insurance premiums, and they have coverage, but they still have to pay about $10,000 a year out of pocket for prescription drugs. Jerry shares with us that our system may work when you're young and healthy, but it fails as you age and need care. What kind of health care system fails when you need health care? When you don't need health care, it works. When you need health care, it fails.
Will the gentleman yield?
I will.
How would you like to have a car like that? I yield back.
What's that?
How would you like to have a car like the one
That's
you
right.
described?
When you do a car. When you don't need to go somewhere, car works fine. The minute you need to get to work, the minute you need to go somewhere to visit your family, car doesn't work. What kind of car is that? That's a lemon.
It works fine, although let's remember you're continuing to pay premiums, often very high ones, every single month, even when you don't need it.
That's right. And let's say you get in one accident or one speeding ticket. You're uninsurable the rest of your life and you can't drive. Well, these are our bodies we're talking about, not cars. And if you have one illness, one pre-existing condition, you are virtually, if you try to buy insurance on your own, uninsurable for the rest of your life through no fault of your own. And that's what Jerry's son is going through at 25. Just takes an antidepressant. Healthy kid. Can't get insurance. Pays a lot for a very basic program that isn't even comprehensive. There are tens of millions of American families, like Jerry's and others, that will benefit from us passing health care reform now. Yield back.
Well, let me just